slideshow.
Gayatri ma'am, there is a icon below which says 74%. Next to that, down
The right hand corner.
top right corner.
Okay.
Yeah, you have that icon which you can put as.
Or you can even press F5, ma'am. F5 should work.
Ma'am, you'll have to reduce the zoom.
Yeah.
And next to that, you have that one box.
F5 you said. Okay, let ma'am try. I'll come back.
Ma'am, I have sent a WhatsApp to you.
That's
Can
live.
you just check that?
Yeah, 1 second. Sorry, I don't know where I've gotten it. Okay, let ma'am check. I will just come back. I'll stop sharing right now. Let ma'am do it.
Ma'am, when you are ready, let me know. I'll stop sharing.
Yeah, you stop sharing. I think you are able to see my screen now? Yeah.
You'll have to share, ma'am.
Now you can
Yes,
see?
ma'am.
Okay.
Yes, ma'am. Ma'am, it's 3. Shall we begin?
Yeah, okay.
Yeah. Okay. Hello, everyone. A very good evening to one and all present here. Welcome to the inaugural event of Dysphagia Special Interest Group of Indian Speech and Hearing Association. Indian Speech and Hearing Association is a professional and scientific association of more than 4,000 members who are speech language pathologists, audiologists, speech language and hearing scientists. Now we have representation from dysphagia specialists in India and in international forum. The Dysphagia Special Interest Group of Indian Speech and Hearing vision is to intends to promote safe and efficient feeding and swallowing through a highest quality professional, ethical, and uniform care. In the mission, we thrive to establish skills and competence in dysphagia rehabilitation service through continued education and training. Expand the scope of practice through sensitization of public healthcare professionals and policymakers in various vernacular language. Facilitate and support research and develop for evidence-based practice and adopting global trends, and to promote innovation in dysphagia rehabilitation. I, Dr. Preeti Shetty, along with Mr. Prasanna Hegde, would be coordinating the Dysphagia Special Group Interest of Indian Speech and Hearing Association. We thank President Dr. M. Jayaram, past President Dr. Krishna Y, Honorable General Secretary Mr. Suman Kumar, Chair Research and Training Promotion Dr. Abhishek BP, and EC members of Indian Speech and Hearing Association for believing us and giving us this opportunity. We have an upcoming webinar tomorrow in association with Indian Academy of Neurology, Indian Federation of Neuro Rehabilitation, and Society for Feeding and Swallowing Disorders, India. And it's a first activity. It is as it's our first activity, it is essential to provide an introduction to specialties in deglotology, that is in terms of onco, neuro, and pediatric. Hence, to commemorate the contribution of Professor Jerry A. Logman, who is a pioneer in the field of dysphagia, and to launch Dysphagia Special Interest Group of Indian Speech and Hearing Association, the theme of this webinar is chosen to be Scope of Dysphagia Practice. We have three Devis with us, that is Dr. B.S. Premlata, Dr. Jay Shri Bhatt, and Dr. Gayatri Hattiangadi, who are going to discuss the scope of dysphagia practice in oncology, neurology, and pediatric, followed by short panel discussion. Our first speaker is Dr. B.S. Premlata. She is a professor at Department of Speech Language Studies, Dr. S.R. Chandrasekhar Institute of Speech and Hearing. Her field of expertise is communication problems in head and neck cancers, dysphagia management, voice problems and its management, speech production, adult language disorders. She has more than 35 years of experience. She has numerous research publications to her credits, both national and international journals. She has 4 chapters to her credits. She is editorial member of Journal of Laryngology and Voice, and she has many awards to her credits. She has also received scholarship to present her work in dysphagia in Japan 2021. Ma'am is going to speak about scope of dysphagia in oncology. It's an honor to have you, ma'am, with us. Over to you, ma'am. We welcome you.
Thank you, Dr. Preeti, for a nice introduction. Let me start sharing my screen. So that we can see the slide.
Yes, ma'am.
Second. I'm able to see 1 second, yeah. Can all of you see the slide?
Yes, ma'am. We can see it.
Okay. Thank you, Dr. Preeti, for a nice introduction, calling us as three Devis in the field of dysphagia. Can you hear me?
Yes, ma'am, absolutely.
Okay. Before I start my presentation, I would like to thank Indian Speech and Hearing Association considering me as one of the resource person to talk about scope of dysphagia in oncology, particularly in head and neck cancer, and also our institute for permitting me to give this talk. So what is the scope of oncology in the field of in oncology? We all of us know that dysphagia is one of the most.
Sorry to disturb. I think we'll have to see a slide.
Not able to see?
Yes, ma'am. You may have to share it.
I'll close it and start.
Yes, ma'am.
One second. You can see now? You can see the slides now? Preeti, you can see the slide?
Yes, ma'am.
I'll go ahead with the...
Yes, ma'am, please.
Okay. What is the scope of dysphagia in the oncology, particularly in head and neck cancer and oral cancer? We all of us know that dysphagia is one of the most disabling consequences, which is going to be the result of the treatment in oncology. Whatever the treatment modality may be, maybe the surgery, maybe the chemoradiation, or maybe the chemotherapy. Whatever it is, it's going to be one of the most disabling consequences which we see, and which is going to result and compromised nutrition and aspiration pneumonia, and most importantly, it's going to affect the quality of life of an individual. And we know that dysphagia is an emerging and developing field, particularly in South India. For the past 3 to 4 decades, dysphagia has slowly taken the step in India, and it's coming up now. In spite of working for almost nearly 3 decades in the field of dysphagia, still I feel it's very interesting and it's challenging. And I'm sure it requires involvement of the multidisciplinary team members. We SLP are preferred as a service provider for a dysphagia clients. Either you are working in an institutional setup or hospital setup, we are considered as a service provider for a dysphagia clients and considered as one of the important member of the multidisciplinary team. What is the scope of this presentation? The purpose of this presentation, the title was given to me, is to talk about the scope of dysphagia practice in India, particularly in head and neck cancer, is to provide a source of information to the flourishing dysphagia community and the youngsters, particularly who wants to take up dysphagia as their field of interest. Over the past decades, a field of dysphagia has grown tremendously, and the community of dysphagia and the researcher have galvanized the ambition to represent dysphagia patients. So with this, I'm going to start my presentation. This presentation is that it is a potential swallowing. I'm going to list out the kind of swallowing disorders seen in oncology, particularly in head and neck cancer and oral cancer. I'm going to list out the effects of surgery, radiation therapy, chemotherapy, and explain how toxicities can affect the swallowing functions in each particular site of lesion. And I'm going to mention the different management strategies for the head and neck cancer populations and describe evidence-based dysphagia management. And most importantly, the role of SLP. What is our scope in the field of oncology? What are we going to do? How are we going to involve ourselves in the head and neck cancer patients throughout the course of treatment, which involves a recognition of the causes, signs and symptoms, and make appropriate assessments and the diagnosis whether the patient is having a oral dysphagia or oropharyngeal phase is affected, and the management strategies. Along with that, I'm going to discuss about all the areas, what is our scope in the field of research in the field of dysphagia, particularly in oncology. With this, all of us must have come across the patient complaining about the signs and symptoms about all the dysphagia. They do say that something is stuck in my throat and have a pain while swallowing, and I have got a fever, I got aspiration, end up in having aspiration pneumonia. And we know that the functional outcome of the treatment, particularly head and neck cancer, is going to be dependent on the site of lesion and the location, extent of lesion. I'm going to talk about one by one in brief. Just I'm going to mention here, and the type of treatment, whether it is a radiotherapy, whether it's a chemotherapy, or surgery, or a combined modality of treatment, and type of surgery, whether it's a laryngeal cancer, whether it's a pharyngeal cancer, or whether it's gastric pull-up cancer or oral cavity cancer, and type of reconstruction, whether it is what kind of reconstruction, is it a PMMC, is it a primary reconstruction, or is it delta pectoral flap reconstruction, and how does chemotherapy and radiotherapy has an impact on that. Apart from all these things, what the patient factor is important, how that's going to affect the functional outcome, as well as the clinician factors, how much experience we are in handling the cases with the dysphagia. We know that dysphagia, as I said, the effect of tumor has got direct impact on dysphagia. This we have found that the two of my students who did PhD thesis in the maxillary lesions and mandibular lesions, as well as a glassectomy and different type of mandibulectomies and laryngeal and pharyngeal, the tumor has got a direct impact on dysphagia. What are various the degrees? And if there is a pharyngeal, patient will have a complaint of swallowing difficulty and wet potato voice if it is a laryngeal, if it is in a supraglottic area, and if it's in the oral cavity, if it's on the tongue or the tonsillar area, the tumor which is sitting on the tongue or on the tonsillar areas will restrict the mobility of the structure, thereby resulting in difficulty in chewing, difficulty in masticating, difficulty in swallowing. There is a direct impact on the bolus separation, bolus proportions, and bolus transmissions. If the lesion is in the esophagus, it may be because of the carcinoma that can cause stricture in the esophagus, patient find difficulty in swallowing, particularly the solid food. They'll have difficulty in swallowing solid because of the tumor which is obstructing the entry of the material into the digestive system. So what about the treatment option? There are different treatment options available for oncological patients to have the oncological clearance, maybe the surgery, radiotherapy, chemotherapy, combined modality of treatment. Depending upon the center, the surgeon, they prefers a combined modality of treatment, that is surgery followed by radiotherapy, chemotherapy in conjunction with the surgeries. So main oncological goal for the cancer surgeon is to have the oncological clearance. The first and foremost goal of any oncologist is to have the clearance from the disease. Depending upon that, if the tissue which is resected small in nature, patient is going to have a lesser impairment. If the resection of the lesion is a major, patient is going to have a major impairment. The main goal of the oncosurgical goal is that the 3 R's, which I like to put, resection, reconstruction, and the rehabilitation. So reconstructing the defect, if the larger resection is done, it's very important in order to have a proper rehabilitation of the bone which has been affected. Type of surgery, we know that laryngeal and pharyngeal esophageal surgeries are very devastating in nature. Patients with a laryngeal cancer will undergo total laryngectomy. Once again, depends upon the stage and the DNM classification, how advanced is the lesion. Depending upon that, the surgeon will decide whether the patient should go for a total laryngectomy or a partial laryngectomy to preserve the functions of the larynx as a biological function of the larynx. If the lesion is in the pharyngeal area or esophageal cancer area, surgeon prefers to do partial pharyngectomy. If the lesion is extended from the point of the pharyngeal area, extensive resection includes laryngo-pharyngeal resection with a gastric pull-up as a surgery. How does this total laryngectomy, pharyngectomy affects the dysphagia? Many might ask that there's no larynx